The United Nations International Institute for Global Health, UNU-IIGH, was conceived to support the UN's global health transformation. It's the UN's think tank in global health. Our key objectives are to transform health research into practical policies that can be implemented in action, with action in mind, making sure that we take account of the local context.
We're very focused on specific policy and implementation problems that developing countries face, and our institute in Malaysia on global health is very much focused on global health challenges in the developing world, building and nurturing and participating in partnerships that lead to practical outcomes. And these can relate to the gender dimension of health, they can relate to universal availability of health services, either at no cost or at low cost. These are very practical concerns of people all over the world, but the challenges in developing countries are greater.
One of the major things that we're able to do is that we are independent and that we are also neutral, and we are able to bring together the UN agencies on topics related to global health that are of interest across them, but for which we don't necessarily have an agenda. So as academics, we can convene and we can engage in dialogue and work directly with the UN, with policymakers, with countries, specifically developing countries, to really get a sense of what is important on the ground and to engage with them on the ground.
There's a lot of really great research that gets stuck in papers and reports on people's desks, not having the impact on health that it could. Our role as the UN's Global Health Think Tank is to help translate that evidence into action. One of the ways that we do that is by bringing people together, representing different sectors and different perspectives. We believe that by providing a neutral space for open and frank discussion, we can generate insights and actions that no single actor would come up by themselves. Ultimately, it's about taking tough problems and generating results-oriented solutions.
We've made bold commitments in global health to gender equality and women's empowerment, but progress remains very limited. We want UN agencies and UN programs working in global health and the health sector in member states to promote gender equality and reduce gender-related disparities in health. We at UNU-IIGH strive to provide and synthesize the evidence to support them to do this and to inform policies and practical approaches to make a difference.
We want decisions around health policy and programming to be informed by the best evidence available. We're committed to strengthening the capacity of decision makers to utilize the evidence at hand when thinking about the health of their populations. Our capacity strengthening efforts focus on empowering decision makers to understand what their data are saying. We strive to equip local health authorities with the skills needed to generate, translate, and utilize evidence. Facilitating collaborations and forming networks across the Global South also helps strengthen local research capacity. It is incredibly important that those with direct knowledge of the context and issues are the ones utilizing locally relevant data to guide the decision-making process. Our goal is that those who are most connected to the health issues at hand lead in the creation of health systems that are both responsive and resilient.
I believe that we have an opportunity here at UNU-IIGH to make Malaysia a learning hub for South-South collaboration in improving global health.